Hey future nurses! Welcome back to NCLEX Made Easy 91, where smart learners become confident nurses. Today's challenge is going to test how deep your renal knowledge really goes. I've put together 50 of the most critical and trickiest NCLEX renal questions that could make or break your exam. Here's the deal. Some of these questions look easy, until you read the options. A few are hidden traps that even top students miss. And the very last question? It's the ultimate test of your critical thinking. So don't skip a single second, because every question builds up to the finale that shows if you're truly NCLEX ready. Grab your pen, stay till the end, and tell me in the comments how many you got right. Let's see who's ready to ace the renal system. Question 1. A client with acute kidney injury, AKI, has a serum potassium level of 6.9 milliequivalent/L. Which physician order should the nurse question? A. Administer sodium bicarbonate 4. B. Administer insulin with dextrose. C. Give spironolactone 25 mg daily. D. Prepare for ECG monitoring. Answer, C. Rationale: spironolactone is potassium-sparing and will worsen hyperkalemia. Question 2. A client receiving hemodialysis reports headache, nausea, and confusion during treatment. What should the nurse do first? A. Slow the rate of dialysis. B. Administer antiemetic. C. Reassure the client this is normal. D. Document findings. Answer, A. Rationale: these are signs of dialysis disequilibrium syndrome, slow dialysis to prevent cerebral edema. Question 3. A client with end-stage renal disease, ESRD, has the following lab results. K 6.8 milliequivalent/L, Ca superscript 2 7.8 mg per deciliter, BUN 58 mg per deciliter, creatinine 9.5 mg per deciliter. Which finding is the highest priority? A. Low calcium. B. Elevated BUN. C. High potassium. D. Elevated creatinine. Answer, C. Rationale: hyperkalemia can cause fatal dysrhythmias, priority intervention required. Question 4. After a renal biopsy, which nursing action is most important? A. Encourage ambulation. B. Assess urine output. C. Maintain bed rest in supine position. D. Monitor temperature. Answer, C. Rationale: bed rest prevents bleeding at the biopsy site, movement increases risk of hemorrhage. Question 5. A client with acute glomerulonephritis reports dark, cola-colored urine. What does this indicate? A. UTI. B. Hematuria from damaged glomeruli. C. Medication reaction. D. Dehydration. Answer, B. Rationale: glomerular inflammation causes RBCs to leak into urine, turning it dark. Question 6. The nurse is educating a client with chronic kidney disease, CKD, about diet. Which food choice shows correct understanding? A. Bananas and orange juice. B. Chicken and white rice. C. Beans and potatoes. D. Nuts and spinach. Answer, B. Rationale: these are low in potassium and phosphorus, appropriate for CKD. Question 7. A client with peritoneal dialysis reports cloudy dialysate drainage. What is the nurse's best action? A. Flush the catheter. B. Reposition the client. C. Notify the physician immediately. D. Continue dialysis. Answer, C. Rationale: cloudy effluent suggests peritonitis, a medical emergency. Question 8. Which finding in a client with AKI indicates recovery phase? A. Oliguria. B. Urine output 3,000 milliliters per day. C. Elevated creatinine. D. Confusion. Answer, B. Rationale: in the recovery, diuretic, phase, kidneys begin to excrete high amounts of dilute urine. Question 9. Which assessment finding requires immediate intervention in a client with nephrotic syndrome? A. Facial puffiness. B. Proteinuria. C. Crackles in lungs. D. Generalized edema. Answer, C. Rationale: crackles indicate fluid overload and possible pulmonary edema, life-threatening. Question 10. A patient with acute pyelonephritis is being discharged. Which statement indicates further teaching is needed? A. I will take all my antibiotics even if I feel better. B. I will increase my fluid intake. C. I'll stop taking antibiotics if urine becomes clear. D. I'll empty my bladder after sexual activity. Answer, C. Rationale: stopping antibiotics early may cause infection recurrence. Question 11. The nurse notes urine output of 20 milliliters per hour in a client with AKI. What is the priority action? A. Increase oral fluids. B. Notify the healthcare provider. C. Document findings. D. Reassess after 4 hours. Answer, B. Rationale: output less than 30 milliliters per hour suggests renal perfusion failure, must be reported. Question 12. A client with CKD has Kussmaul respirations. What does this indicate? A. Fluid overload. B. Respiratory alkalosis. C. Metabolic acidosis. D. Hypokalemia. Answer, C. Rationale: CKD causes retention of acids, Kussmaul respirations compensate by blowing off CO2. Question 13. During hemodialysis, the nurse notes the client becomes restless and hypotensive. What should be done first? A. Stop dialysis. B. Slow the flow rate. C. Give 4 fluids. D. Notify physician. Answer, B. Rationale: hypotension during dialysis is often due to fluid removal, slow the rate first. Question 14. Which medication should be held before dialysis? A. Erythropoietin. B. Furosemide. C. Antihypertensive drugs. D. Phosphate binders. Answer, C. Rationale: antihypertensives may cause hypotension during dialysis. Question 15. A patient with CKD asks why they are receiving calcium carbonate. The nurse should explain it is to A. Prevent constipation. B. Reduce phosphate absorption. C. Increase bone calcium. D. Neutralize stomach acid. Answer, B. Rationale: calcium carbonate binds dietary phosphorus in the gut, reducing serum phosphate levels. Question 16. A client with a ureteral stone reports sudden severe right flank pain, nausea, and gross hematuria. Which action by the nurse is best first? A. Give oral analgesic and send home. B. Assess vital signs and notify the physician for pain control and possible intervention. C. Encourage ambulation to pass the stone. D. Prepare for immediate lithotripsy at bedside. Answer, B. Rationale: sudden severe pain with hematuria requires assessment and prompt intervention, analgesia, imaging, urology consult. Question 17. A client with CKD has hemoglobin of 8.0 g/dl. Which order is most appropriate to question? A. Start epoetin alpha per protocol. B. Administer oral iron supplements. C. Transfuse 1 unit packed RBCs for symptomatic anemia. D. Start high-dose 4 vitamin K. Answer, D. Rationale: vitamin K treats coagulopathy, not anemia, inappropriate here. Question 18. A client on continuous ambulatory peritoneal dialysis, CAPD, complains of abdominal pain and low-grade fever. Dialysate appears cloudy. What is priority nursing action? A. Continue treatment and re-evaluate in 24 hours. B. Obtain culture of dialysate and notify provider for peritonitis treatment. C. Have client ambulate to improve drainage. D. Instruct client to decrease dialysate dwell time. Answer, B. Rationale: cloudy effluent with pain/fever indicates peritonitis, culture and antibiotics are required. Question 19. A nurse is teaching a client about acetazolamide. Which statement by the client indicates correct understanding? A. It will help remove extra potassium. B. It helps correct metabolic alkalosis by promoting bicarbonate excretion. C. It is a loop diuretic and will reduce edema. D. It increases phosphate absorption. Answer, B. Rationale: acetazolamide is a carbonic anhydrase inhibitor that increases bicarbonate excretion and can correct metabolic alkalosis. Question 20. A client in the oliguric phase of acute tubular necrosis, ATN, will most likely have which lab finding? A. Decreased serum potassium. B. Metabolic alkalosis. C. Rising BUN and creatinine with hyperkalemia. D. Low specific gravity urine with high urine output. Answer, C. Rationale: oliguric ADN causes azotemia and hyperkalemia from impaired excretion. Question 21. Which assessment best indicates the AV fistula for hemodialysis is functioning? A. Cool arm with absent pulses. B. Presence of brute and palpable thrill over the fistula. C. Capillary refill greater than 5 seconds in the hand. D. Decreased sensation in fingers. Answer, B. Rationale: A brute and thrill indicate good blood flow through the fistula. Question 22. A client with CKD is prescribed sodium polystyrene sulfonate, Kxalate. The nurse should monitor which lab closely? A. Serum sodium and potassium. B. Serum calcium only. C. Urine-specific gravity. D. Serum albumin. Answer, A. Rationale: Kxalate exchanges sodium for potassium, affects both potassium and sodium levels. Question 23. A client develops contrast-induced nephropathy after CT with contrast. Which prevention strategy would have been most effective pre-procedure? A. Give ACE inhibitor the morning of the scan. B. Hydrate with 4-normal saline before and after contrast. C. Withhold all oral medications for 48 hours post-scan. D. Give high-dose magnesium prior to contrast. Answer, B. Rationale: for hydration reduces risk of contrast nephropathy. Question 24. A patient with nephrotic syndrome is admitted. Which problem has highest priority? A. Periorbital edema. B. Lipid abnormalities. C. Risk for infection. D. Mild ankle swelling. Answer, C. Rationale: loss of immunoglobulins in nephrotic syndrome increases infection risk, life-threatening. Question 25. Which client should the nurse see first? A. Stable CKD outpatient for routine dialysis education. B. Post-op renal transplant with sudden oliguria and rising creatinine. C. Peritoneal dialysis client with scheduled exchange due. D. Patient with history of stones asking for dietary advice. Answer, B. Rationale: sudden oliguria and rising creatinine after transplant suggest rejection/acute failure, urgent. Question 26. A client with BPH has acute urinary retention. Which action is priority? A. Start tamsulosin and observe. B. Insert a straight catheter to relieve retention. C. Encourage fluids and ambulation. D. Teach pelvic floor exercises. Answer, B. Rationale: acute retention requires immediate bladder decompression with catheterization. Question 27. Which acid-base disturbance is most commonly seen with end-stage renal disease? A. Respiratory alkalosis. B. Metabolic acidosis with decreased bicarbonate. C. Metabolic alkalosis due to vomiting. D. Respiratory acidosis due to hypoventilation. Answer, B. Rationale: kidneys can't excrete acid or regenerate bicarbonate metabolic acidosis. Question 28. A client on furosemide develops muscle weakness and constipation. Which lab should the nurse check? A. Serum potassium. B. Serum calcium. C. Serum albumin. D. Serum glucose. Answer, A. Rationale: loop diuretics can cause hypokalemia, presenting as muscle weakness and constipation. Question 29. A patient with a continuous bladder irrigation after TURP becomes confused and has nausea and bradycardia. Which complication should the nurse suspect? A. Bladder spasm. B. TURP syndrome, water intoxication/hyponatremia. C. UTI. D. Hemorrhage only. Answer, B. Rationale: irrigation with hypotonic fluid can cause hyponatremia leading to TURP syndrome, confusion, nausea, bradycardia. Question 30. A client with CKD is prescribed calcitriol. The nurse should assess for which expected effect. A. Decrease serum calcium. B. Improve vitamin D activation to help with bone metabolism and increase calcium absorption. C. Increase phosphate excretion in the urine directly. D. Cause metabolic acidosis. Answer, B. Rationale: calcitriol, active vitamin D, increases calcium absorption and helps bone mineralization. Question 31. Which finding is most consistent with chronic pyelonephritis? A. Sudden severe flank pain with high fever. B. Recurrent urinary tract infections with scarring of renal tissue and hypertension. C. Isolated microscopic hematuria without symptoms. D. Painless gross hematuria only at night. Answer, B. Rationale: chronic pyelonephritis results from recurrent infection, scarring, and possible HTN. Question 32. A nurse is teaching a client about dietary restrictions for hyperphosphatemia in CKD. Which food should the nurse tell the client to avoid? A. White rice. B. Milk and dairy products. C. Fresh apples. D. Olive oil. Answer, B. Rationale: dairy is high in phosphorus, CKD patients must limit phosphorus. Question 33. A client with stage 4 CKD is experiencing pruritus. Which intervention is most appropriate? A. Encourage hot showers to soothe skin. B. Apply emollients and maintain skin hydration. Discuss phosphate control with provider. C. Increase phosphate intake to relieve itch. D. Stop all moisturizers and use alcohol-based products. Answer, B. Rationale: moisturizers help, pruritus is associated with phosphate/uremic buildup, address biochemical control. Question 34. Which medication is contraindicated in acute kidney injury due to risk of worsening renal function? A. Acetaminophen. B. Gentamicin, an aminoglycoside. C. Insulin. D. Calcium acetate. Answer, B. Rationale: aminoglycosides are nephrotoxic and can worsen AKI. Question 35. A dialysis client asks why he feels cold after treatment. The best nurse response is: A. You must have an infection. B. Hypothermia is a sign of dialysis failure. C. Rapid fluid removal and exposure to cool dialysis solution can cause you to feel chilled. We can provide blankets. D. You should exercise immediately after dialysis. Answer, C. Rationale: dialysis can cause a sensation of cold, warming measures are appropriate. Question 36. Which electrolyte abnormality is expected in a client with rhabdomyolysis that can precipitate renal failure? A. Hypokalemia. B. Hyperkalemia from muscle breakdown. C. Hypophosphatemia. D. Hypercalcemia early on. Answer, B. Rationale: muscle cell lysis releases potassium, hyperkalemia and myoglobin, renal injury. Question 37. A client with CKD stage 5 asks about transplant eligibility. Which statement indicates correct understanding? A. I will be eligible as long as I have good cardiac and psychosocial evaluation and no contraindications. B. Anyone with CKD automatically receives a transplant. C. I will not need lifelong immunosuppression after transplant. D. Transplant cures all my health problems completely. Answer, A. Rationale: transplant requires evaluation and lifelong immunosuppression. Not everyone is eligible. Question 38. A patient admitted with suspected glomerulonephritis has periorbital edema, cola-colored urine, and hypertension. Which test result best supports the diagnosis? A. Positive antistreptolysin O, ASO, titer with RBC casts in urine. B. Elevated liver enzymes. C. Elevated blood glucose only. D. Low BUN and creatinine. Answer, A. Rationale: post-streptococcal glomerulonephritis often shows positive ASO and RBC casts. Question 39. Which action should the nurse take when a hemodialysis client complains of cramping during ultrafiltration? A. Increase ultrafiltration rate. B. Stop ultrafiltration and give a bolus of saline as ordered or slow the rate. C. Encourage the client to stand and walk. D. Administer furosemide immediately. Answer, B. Rationale: cramps often result from excessive fluid removal. Stop/slow ultrafiltration and give fluids. Question 40. A client with AKI secondary to sepsis has metabolic acidosis. Which ABG finding is consistent? A. pH 7.52, HCO3 36 milliequivalent/L. B. pH 7.28, HCO3 16 milliequivalent/L. C. pH 7.60, PaCO2 30 mm of mercury. D. pH 7.45, HCO3 24 milliequivalent/L. Answer, B. Rationale: low pH and low bicarbonate indicate metabolic acidosis. Question 41. A nurse is teaching a client taking a phosphate binder, sevelamer. Which statement by the client shows understanding? A. I will take it with meals to bind dietary phosphate. B. I can stop my phosphate binder when I feel better. C. I should take it on an empty stomach. D. It will increase my potassium level. Answer, A. Rationale: phosphate binders are taken with meals to bind dietary phosphate. Question 42. Which sign indicates early peritonitis in a client on peritoneal dialysis? A. Clear, straw-colored effluent. B. Cloudy effluent with abdominal pain and low-grade fever. C. Increased appetite. D. Hypertension only. Answer, B. Rationale: cloudy effluent with pain/fever is an early sign of peritonitis. Question 43. Which nursing action is most important when assessing a client with acute renal colic from a ureteral stone? A. Assess pain level and provide opioid analgesia as ordered. B. Perform a digital rectal exam immediately. C. Restrict all fluids until stone passes. D. Give broad-spectrum antibiotics immediately. Answer, A. Rationale: pain control is top priority, antibiotics only if infection present. Question 44. A client with CKD complains of fatigue and dizziness. The nurse notes the patient's BP is low and asks if the patient takes antihypertensives. Which medication class would most likely require holding before dialysis? A. Proton pump inhibitors. B. ACE inhibitors/ARBs, antihypertensives. C. Multivitamins. D. Phosphate binders. Answer, B. Rationale: antihypertensives can cause hypotension during dialysis and are often held. Question 45. A client has a creatinine clearance, measured, of 25 milliliters per minute. Which instruction is most important? A. Avoid nephrotoxic drugs and consult provider before starting new meds. B. Increase intake of NSAIDs for pain control. C. No need for diet changes. D. Stop all antihypertensives. Answer, A. Rationale: low clearance indicates significant renal impairment, avoid nephrotoxins. Question 46. A patient with suspected urinary retention after surgery has a bladder scan showing 650 milliliters. The nurse's best immediate action is: A. Document and rescan in 4 hours. B. Perform straight catheterization to empty the bladder as ordered. C. Encourage client to void in bedpan only. D. Call urology for surgery consult. Answer, B. Rationale: significant retention requires immediate decompression via catheterization. Question 47. Which clinical finding suggests nephrogenic diabetes insipidus rather than central DI? A. Good response to desmopressin, ADH analog, with decreased urine output. B. No change with desmopressin and continued polyuria with dilute urine. C. Elevated ADH level in blood test. D. Hyperglycemia causing osmotic diuresis. Answer, B. Rationale, nephrogenic DI is ADH resistance, no response to desmopressin. Question 48. A dialysis patient has a blood pressure of 80/50 mmHg, lightheadedness, and nausea during treatment. Which action should the nurse take first? A. Increase dialysate temperature. B. Trendelenburg position, stop ultrafiltration, give 4 bolus as ordered. C. Continue treatment and reassess in 30 minutes. D. Encourage client to drink fluids orally. Answer, B. Rationale, these are signs of interdialytic hypotension. Immediate interventions include Trendelenburg, stopping fluid removal, and giving 4 fluids per protocol. Question 49. A client with chronic kidney disease is prescribed iron sucrose for. Which statement indicates understanding of the teaching? A. I should expect the infusion site to be red and painful, that's normal. B. I may need monitoring for hypersensitivity reactions during and after the infusion. C. This will replace all my need for erythropoietin. D. I should stop eating iron-rich foods while on this medication. Answer, B. Rationale, for iron can cause hypersensitivity, monitoring during infusion is necessary. Question 50. A nurse is planning discharge teaching for a patient who had a renal transplant. Which statement by the patient indicates the need for further teaching? A. I will take my immunosuppressive medications exactly as prescribed. B. I will avoid crowds and report any fever or signs of infection immediately. C. If I get sick, I can stop my immunosuppressants until I feel better. D. I should keep follow-up appointments for labs and biopsy as recommended. Answer, C. Rationale, stopping immunosuppressants puts the graft at risk for rejection. They must be continued and the provider contacted for illness management. Wow, you made it to the end. That means you're serious about becoming an NCLEX champion. Now here's your challenge. Drop your score or your favorite question number in the comments below. Let's see who mastered today's renal system showdown. Remember, success isn't about luck, it's about consistency and smart practice. So if you want more videos like this, with real NCLEX-style challenges that push you to think like a nurse, hit subscribe. Turn on the bell. And join our growing family of future RNs who are crushing this exam together. Until next time, stay focused, stay fearless, and remember. On Nclex Made Easy 91, we don't just study nursing, we live it.